Thank you for tuning in to NurseEdScholar. I bet you didn't know that too much calcium in your blood can lead to serious health issues. Hypercalcemia is a condition in which there is too much calcium in the blood. Calcium is an essential mineral vital in many bodily functions, including muscle contraction, nerve function, and blood clotting. However, when calcium levels are too high, serum calcium exceeding 10.5 milligrams per deciliter, can lead to various health problems. Common causes include hyperparathyroidism, cancer, certain medications, and excessive oral calcium and vitamin D intake. The severity of symptoms often correlates with the degree of elevation in calcium levels. Symptoms can include nausea, vomiting, constipation, abdominal distension, and confusion. Hypercalcemia can be mild and asymptomatic, often detected incidentally during routine blood tests. However, as calcium levels rise, symptoms become more apparent and can range from mild discomfort to life-threatening complications. Understanding the causes, symptoms, and treatment of hypercalcemia is crucial for healthcare professionals to ensure early detection, prompt management, and improved patient outcomes. Initial nursing interventions include rehydration with IV fluids, monitoring vital signs, and educating patients on the importance of follow-up care. Remember, early intervention can prevent severe complications. Hypercalcemia arises from an imbalance in calcium regulation, primarily involving four main mechanisms: increased calcium absorption, decreased calcium excretion, increased bone resorption, and hemoconcentration. Each of these mechanisms disrupts the delicate balance of calcium homeostasis, leading to elevated blood calcium levels. Excessive calcium intake, often through supplements or medications containing calcium or vitamin D, can overwhelm the body's ability to regulate calcium levels, resulting in hypercalcemia. Certain medical conditions characterized by excessive consumption of calcium carbonate-containing antacids can also increase calcium absorption. The kidneys are crucial in filtering and excreting excess calcium from the body. When kidney function is impaired, such as in chronic kidney disease, calcium excretion is reduced, leading to its accumulation in the bloodstream. Medications like thiazide diuretics, commonly used to treat high blood pressure, can also decrease calcium excretion, contributing to hypercalcemia. Bones serve as a reservoir for calcium, and under normal circumstances, there is a balance between bone formation and bone resorption. Certain conditions, such as hyperparathyroidism, malignancies, and prolonged immobilization, can disrupt this balance, leading to increased bone resorption and calcium release into the bloodstream. Dehydration, a condition characterized by decreased body fluid volume, can lead to hemoconcentration, in which the concentration of substances in the blood, including calcium, increases. This is because the total amount of calcium in the blood may remain the same, but the reduced fluid volume makes it appear more concentrated. Common conditions to remember include hyperparathyroidism, chronic kidney disease, and malignancies. Always consider patient history and medication use when assessing for hypercalcemia. Hypercalcemia can manifest with many symptoms, often affecting multiple organ systems. Understanding these impacts is crucial for effective management. Recognizing these symptoms early is essential for prompt intervention and better patient outcomes. The severity of symptoms typically correlates with the degree of elevation in calcium levels. Higher levels often mean more severe symptoms. Hypercalcemia can affect the heart's rhythm and electrical activity. In the early phase, patients may have an increased heart rate. However, as hypercalcemia progresses, the patient may develop bradycardia, which can lead to cardiac arrest. As a nurse, you will also see increased blood pressure, bounding, full peripheral pulses, and EKG abnormalities such as a shortened ST segment, widened T wave, and heart block, which can be seen on an EKG. Nursing tip: remember, a shortened ST segment is a key indicator of hypercalcemia. In severe cases, it can cause cardiac arrhythmias, which are irregular heartbeats that can be life-threatening. Nursing tip: always monitor cardiac function in patients with high calcium levels. Although less common, hypercalcemia can affect the respiratory system. It causes ineffective respiratory movement due to profound skeletal muscle weakness, shortness of breath, and a rapid breathing rate. Elevated calcium levels can interfere with nerve and muscle function, leading to muscle weakness, diminished or absent deep tendon reflexes, fatigue, confusion, and lethargy. In severe cases, it can cause seizures, coma, and even death. The kidneys play a vital role in calcium regulation, and hypercalcemia can significantly impact kidney function. It can lead to excessive urination, dehydration, and the formation of calcium stones in the kidneys. Hypercalcemia can disrupt the normal functioning of the digestive system, leading to symptoms such as anorexia, nausea, vomiting, constipation, decreased motility, hypoactive bowel sounds, and abdominal distension. Section 4. Nursing Interventions, Addressing High Calcium Levels. Managing hypercalcemia involves a multifaceted approach to lowering blood calcium levels, addressing the underlying cause, and managing symptoms. This requires a comprehensive understanding of both pharmacological and non-pharmacological interventions. Nursing interventions are crucial in this process. They focus on fluid and medication management, inhibiting calcium resorption, and dialysis in severe cases. Remember, early detection and prompt intervention are key. One primary intervention in hypercalcemia is promoting hydration through intravenous fluid administration. This helps dilute the calcium concentration in the blood and promotes its excretion through the kidneys. Medications like loop diuretics, such as furosemide, may further enhance calcium excretion. These medications help the kidneys remove excess calcium from the blood. Medications that inhibit calcium resorption from the bone, such as phosphorus, calcitonin, bisphosphonates, and prostaglandin synthesis inhibitors such as non-steroidal anti-inflammatory drugs, are often used to lower calcium levels by slowing bone resorption, especially in cases of malignancy-associated hypercalcemia. These medications work by slowing down the activity of osteoclasts, the cells responsible for bone breakdown. In severe cases of hypercalcemia, particularly when medications fail and kidney function is compromised, dialysis may be necessary. Dialysis is a procedure that filters the blood, removing excess calcium and other waste products. Continuous monitoring of vital signs, calcium levels, and fluid balance is crucial throughout the management of hypercalcemia. Nursing interventions also focus on monitoring for signs of pathological fractures due to weakened bones and moving patients carefully to avoid injury. Nurses will provide supportive care to manage symptoms, such as pain in the flank or abdominal area due to urinary stones, addressing nausea and vomiting, and ensuring adequate nutrition. By following these interventions and tips, nurses can effectively manage hypercalcemia and provide the best care for their patients. Section 5. Dietary Management, Navigating Food Choices with Hypercalcemia. Dietary modifications are crucial in managing hypercalcemia, particularly in cases where dietary intake contributes to elevated calcium levels. Nursing students should remember that the primary goal is to reduce calcium intake and promote its excretion through dietary choices. The primary goal is to reduce calcium intake and promote its excretion through dietary choices. Patients with hypercalcemia are often advised to limit their intake of calcium-rich foods, such as dairy products like milk, cheese, yogurt, fortified cereals, tofu, and some leafy green vegetables. It's important to note that completely avoiding calcium is not recommended, as it is an essential nutrient. Nursing students should remember to educate patients on balancing calcium intake without overconsumption. Adequate fluid intake promotes calcium excretion. Electrolyte imbalances, particularly low potassium levels known as hypokalemia, can occur with increased calcium excretion. Therefore, monitoring potassium levels and potentially supplementing with potassium-rich foods or supplements may be necessary. Practical tip: recommend potassium-rich foods like bananas, avocados, and spinach. High sodium intake can worsen calcium levels by promoting kidney reabsorption. Therefore, reducing sodium intake by limiting processed foods, salty snacks, and table salt is generally recommended. Section 7. Key takeaways. Essential points on hypercalcemia. Hypercalcemia, characterized by elevated blood calcium levels, is a potentially serious condition that requires prompt recognition and management. Understanding the various causes of hypercalcemia, including increased calcium intake, decreased excretion, increased bone resorption, and hemoconcentration, which are crucial for effective management. Remember, conditions like hyperparathyroidism and malignancies are common culprits. Recognizing the diverse symptoms of hypercalcemia, ranging from mild fatigue and constipation, to severe cardiac arrhythmias and neurological complications, which are essential for timely intervention. Treatment is individualized. Management of hypercalcemia is tailored to the underlying cause and severity of the condition. It often involves a combination of fluid therapy, medications to lower calcium levels, and addressing the root cause. Nursing students should focus on understanding the rationale behind each treatment modality. Nurses are pivotal in managing hypercalcemia, from monitoring vital signs and calcium levels, to administering medications, providing patient education, and offering supportive care. Thank you for watching NurseEdScholar. If you found this video helpful, please like and subscribe for more nursing-related content.